everyone, and welcome to episode 4 of Fireside Conversations with Cape for Health. This is Dr. Ramya Mohan here, and I'm delighted to introduce our guest for the evening, Dr. Padmalata. Hello, Dr. Padmalata. Nice to meet you.
Hi, Ramya. And hi, everyone.
Wonderful to see
Nice
you
to
here
be
today,
here.
and thank you for joining us. So, for everyone who's watching, Dr. Padmalata is a consultant in obstetrics and gynecology at Sparsh Hospital in Bangalore. So she is Dr. Padmalata, MBBS, DNB, has extensive experience of gynecology from the point of view of endoscopy, obstetric ultrasound, rich experience in her area of specialization before joining Sparsh, because you were at St. Martha's and at the Baptist Hospital as well, weren't you, in Bangalore? Over 2 decades of experience. Clearly, your experience reflects in the management of normal and extremely complex pregnancies, all gynecological procedures, including laparoscopic hysterectomy, vaginal surgeries like non-descent vaginal hysterectomy, etc. So Dr. Padmalata's special interests include high-risk obstetrics, obstetric ultrasound, endoscopic and vaginal surgeries. And I've known Dr. Padmalata for a very long time, and she's very patient-centric, practical, and she has a no-nonsense approach that seems to work very well. So without further ado, let's welcome Dr. Padmalata. Nice to meet you, Dr. Padmalata, today, and have you here as our guest for the evening.
Thank you, Ramya.
Wonderful. So I just thought it would be really helpful for us to perhaps look at why you went into your career in women's health. So if you can just give us a bit of a brief about what drew you to that, and we'll talk a bit more about our topic of the day, which is about, we'll be focusing very much on pregnancy, aren't we? And that immediate time immediately after, which is childbirth in the first year of life, really, for the infant. So what drew you to women's mental health and in particular obstetrics?
So when it was the time for me to choose my area of specialization, the fact that you're dealing dynamically with 2 lives and you do make a difference in the outcome drew me to this field. And it's just started off and I have no regrets. I really enjoy doing what I'm doing.
Yes, and the smile says it all, of course. You're clearly enjoying what you're doing, which is wonderful. I just thought it'd be really helpful for our audience to get a very practical sense of what happens in day-to-day life, with a particular focus, of course, on mental health. So it'd be really helpful if you could maybe run us through a few common scenarios you might encounter, whether it's about how you support professional women as opposed to perhaps homemakers, what goes through. That would be a good start. Yes.
Well, we can look at it in different perspectives of different backgrounds of people. Say, if we take homemakers who are facing this change in life, that is pregnancy. It is not a disease, it's not a condition, it's just what we should say as a change in life or inviting a change in life. The lady in question and her family are all getting set to invite a new addition to their family. And this goes right from the time of testing the pregnancy test positive to delivery and then take it forward. So things start with the beginning of knowing that they are pregnant. Well, so once you get to know that someone is pregnant, they have to kind of digest it, accept it, enjoy it, or, feel good or whatever about it. So when it is a planned pregnancy, when the person is well prepared and looking forward for a pregnancy, then it is definitely a matter of joy, and she will take it positively. And because they are planned, they are having some ideas about what the implications of pregnancy will be on their future, and how they are going to take forward the future, as in the duration of pregnancy, and future also as in how they are going to deal with the baby after it's born, and how do they take care, and etc., etc. So these things start right from there.
Yeah.
And if it is not a planned pregnancy, or if it is an accidental pregnancy, or not really a welcome pregnancy, then it does pose some challenges. They have to look back and think whether how they are going to deal with it. Are they going to they, as in the lady and the spouse and the family, if they are also involved in decision making, whether they're going to take it forward or they are not going to continue with the pregnancy, and hence the journey starts it all from right from there.
Absolutely. And either way, it's a big life change, isn't it? And that's
Yes.
what it is. And because it's such a big life change, planned or unplanned, we're here now. And how do we progress into a completely different phase of life for everyone involved, the mother, the future baby, the family, the whole lot? So what are some of the commonest experiences you've had of, say, how the family might get on board with a pregnancy? What do you think, in your experience, from your perspective as a gynecologist, where do you think mental health comes in? What is your understanding of that very complex interplay between a mother or a mother to be and her family?
Yeah, definitely. Once the people they get to know about it, it's all about support from the spouse and the um, uh, as in the other family members. In India, we have this joint family system, because of which there are a lot of implications of pregnancy of the women on the on and from the family to the lady. The family makes a lot of difference in their support of the pregnancy. And so if it is a welcome one, as I told previously, obviously they will all be very supportive. And once they are very supportive, right from the physical way, mental way, then overall the lady will be happy and will be able to take the changes associated with pregnancy in a more positive way.
Mm-hmm.
Changes can be the physical changes which may happen. For example, a person who is completely fit and doing all their work themselves and are also doing a lot of nowadays exercise is something which commonly which people do. So physically active person may face certain challenges, like they can have nausea, they can have vomiting, they can have some kind of gastritis, sometimes pregnancy related problems as well. And if the family is very supportive and understanding, they can take off certain burdens from the ladies' shores to of daily shores, as well as be more supportive. And then this helps, like say, if she's the person who prepares meals and then she's having a lot of problems with nausea and smell, and that leads to excessive vomiting, if she can be taken off those duties, which is uh, definitely with the help of the support of spouse and family, then she'll be a lot better in dealing with these issues.
So it's better
Actually,
to
we
be
see that
planned.
there are, yes, and we also see certain instances where a lady has what we call as hyperemesis, that is excessive vomiting, which sometimes requires admissions and intravenous fluids and a lot of medications. And this can happen repeatedly. The same lady, if she changes her scenario, so like say we admit them, treat, and then she's better, she goes home, again she comes back. The same girl, if she goes to her more favorable environment like her mother's house or so, then she tolerates that and she endures that. She doesn't need any more admissions. Her vomiting reduces.
Mm-hmm.
She's comfortable. This
Yes,
is a very important example where we can understand that mental health is very, very important for your
absolutely.
physical well-being as well.
Yes, and it's all to do with stress management and the stress response and how supported the young mother to be feels. And of course, an additional complexity is when there is a scenario where where she's a working professional. Of course, well, there are two completely different scenarios, aren't they? If she's a homemaker, she's
Yes,
having to take on the burden of the whole home.
right.
So being able to delegate that may not be easy for her. mentally as well, but it's required. But it also, from a practical perspective, it may not be possible because there's such an excessive dependence on her to manage and run the household. So there's that aspect. And with the professional mother to be, there is, of course, the additional kind of requirements around work and what time, time off work, and when do I inform my employer, and what kind of an impact will that, of course, have on my career? So there's a different set of problems or difficulties that one has to navigate. What are your thoughts and experiences on that?
Yes. So if we take a person who is like going for a job or working, in addition to looking after the home, so she definitely has extra duties and extra pressures and stress on her, which again adds upon when the pregnancy scenario is taken. So sometimes some jobs can be physically more strenuous. And if this lady in question has a certain high risk scenarios like previous abortions or previous pregnancy issues, or she may be having some medical issues like hypertension, diabetes, all these things. So with these kind of high risk and pregnancies, so there is always a lot of difficulty in carrying forward their duties at the workplace, especially if it is physically strenuous and it involves like not being able to eat on time and dealing with nausea, vomiting, unfavorable circumstances. These things can exaggerate her physical problems, and definitely her productivity may reduce. So this can have an impact on the job. And she, knowing that her productivity may reduce, she may herself feel a little difficult to cope up physically, also may feel a little inferior that she may not be able to be productive, and what will the others think of me? And what will the colleagues think? What will the management think? What will they? What are their expectations? And we do all know that it's fact that not all pregnancies are taken well in the work environment. There are many scenarios where they're asked to quit also sometimes when
there's
they know that
constant fear whether or not
is,
it happens of discrimination.
Fear also is there, and some companies, some workplaces do have these policies of not supporting well, and that is not really acceptable. So it can be challenged, but practically such scenarios are there and everybody do experience.
Yes.
In this scenarios, if the lady gets a support from her, say her friend in the workplace or an understanding superior, and these things can be dealt with easily. And take my word, if a lady is well supported and if her pregnancy is well supported medically also, then she can be equally productive and she need not feel any inferior.
Absolutely.
Yes. So she can deal with it in a very positive way. There are many, many women who can continue to work till the last day. They can go in labor to their hospital. So till then, they can continue to work, and with that attitude in mind, then the pregnancy journey also becomes much easier.
Absolutely, and this is where organizational cultures come in, where one is being supportive to a mother to be, and as such, in fact, even helping them optimize their time before their time off. So it's helpful to the company as well as to the mother. And yes, of course, a really essential point you raised really is about education, about educating, working with employers as well as the mother to be, to say, well, actually life can go on as normal, but also at the same time ensuring that there's a robust support system and a good circle, both at home and at work, and to start having some of those conversations so the young mother to be can feel supported, and particularly relevant, of course, if there are other children as well, right? If there are other children, the second, we all know that when you have a second child, the work doesn't just multiply, it's exponentially increase. So it's about bearing that in mind as well. Absolutely. And certainly in my practice, of course, we always come across the other side of the coin where we know the devastating impact stress can have on a pregnancy, on the viability of the pregnancy or on the health of the mother and baby, both of those. And particularly in instances where there have been, as you rightly pointed out earlier, bereavement or earlier loss, where if there have been abortions or miscarriages, the anxieties are heightened. There's always more worry, more stress. And there's also an increasing pressure put by the families as well. They don't mean to, but some of the anxiety leaks out. And it kind of spills over to the mother as well, doesn't it? Mother to be as well. Yes. I suppose education or lack of education has a big role to play, doesn't it? Because in terms of whether the mother is financially independent or irrespective whether she's working or not, if she's able to take an informed perspective, if she is able to take an informed perspective, or the family can. What are your experiences in this area?
Education does go a long way in making the woman confident, and along with her financial independence also makes her feel very comfortable to choose whatever she wants to do and not. And but in the other side of coin, if somebody is like we say, little knowledge is too dangerous. So when you are educated and you kind of partially know certain things, you can extrapolate it to something and you can something bad, and you can start thinking deeper and start worrying and start this thing that can affect the health of the woman. Whereas if there is a little less educated girl who just trusts her caretakers, whether it is the doctor or the family, and then she just goes and just takes it very light and happy go mentality, then her journey will be more easier. So whatever is your background, ultimately your attitude is what is most important when it comes to facing certain challenges. But an educated woman can have a score when it comes to understanding her limitations or her difficulties, which can give her a little more dedication or perseverance to follow the medical whatever the instructions given by her doctor, and then she can take it forward more easily. So either way, going forward with more confidence and just perseverance is what going to help.
And timely education as well from the professional, from the specialist that they visit, isn't it? And
seeking the medical care at the right time and from the right people is very much essential. So, and here we can say that the recognition of any problem, mentally, some kind of effect which the women may be facing, should be recognized by herself and as well as her family or her friends or whoever is there with her. So sometimes we notice that it can be as simple as the lady is not able to carry out her normal activities. She looks maybe a little withdrawn, a little different, or she's overreactive, or sometimes simple things like she's forgetting her usual things. Her mental acuity may be looking a little different from usual. These kind of changes when she finds in her daily life, whatever she could do previously, she's probably not able to do. I mean, as a mental way, whatever challenges generally she faces previously, well, if she's unable to do, if she is able to recognize those things, and she has recognized, or her spouse or her people are finding that she's behaving a little different, either maybe a little withdrawn or cries a lot, or feels it difficult, unable to sleep, or sleeps a little more and not able to cope up with the situations. If they are able to keenly observe and kind of recognize and then seek a timely help, it's going to help in dealing with the situations before things can go worse.
Absolutely, absolutely. So there are, as we are well aware, there are conditions, mental health conditions that can potentially surface for the first time in pregnancy. There is unfortunately an increased association with anxiety in particular, depression as well, whether it's pregnancy or immediately after postpartum. But yes, as you rightly said, the support system around the mother to be is vital in this sense. Particularly, there are some conditions, of course, that I encounter in my physical, in my practice as well, where the woman is pregnant, but she's also extremely vulnerable, whether it's because of a learning disability or maybe diagnosed autism or a pre-existing mental health condition, and she's already getting some support or treatment for that. These
Yes.
are, of course, very just a few examples, but we can think of quite a few others. Even physical health problems, for example, a long-standing diabetic, for example, and her state of mind also comes to
Yes.
mind. So in these kind of scenarios, do you have any specific pointers for the family, for the spouse in particular? Because of course we know that the partner plays the single most he plays a pivotal role, doesn't he, the father of the child? So what's your guidance to them?
So some of these scenarios could be pre-existing. In case of pre-existing, sometimes the lady in question may be on some medication for the control of the condition, and some of these medications may have certain ill effects, especially when they are taken in the first trimester. First trimester is the time from the time of conception till 3 months complete. So, like medically, we say up to 12 weeks. So, this period, especially up to 10 weeks, is a very vulnerable period for the baby, because a single cell to a complete baby formation happens in this first trimester, or this is called embryogenesis. And any kind of insult to the growing embryo, could it be medications, fever, or any viral illness, or X-ray exposure? These are the common things which can affect the fetus in question. And some of these medications which the women may be taking, whether it is a pre-existing mental conditions or other medical conditions like diabetes, hypertensive, those medications can be detrimental to the baby. And hence, it's very, very important that the safety of the medications are assured. And for this, preconceptional counseling, where the women and the spouse can go to the uh, gynecologist or the physician, and then talk about the medications, and then take measures to switch over to safer medications of pregnancy, and then continue these throughout the pregnancy with the appropriate medical guidance.
Absolutely. And of course, also being aware that there are certain drugs which are teratogenic, i.e., they can cause
Yes.
fetal malformation. So it's also important for the prescribing physician and the psychiatrist to work together very closely, isn't it? And
Yes.
to ensure that there isn't any kind of untoward interaction or impact.
Yes.
Definitely. And there are, of course, scenarios like whether it's an identified or unidentified learning disability or a neurodevelopmental condition like autism, where the mother is quite vulnerable because of the nature of the condition, and as such is not really able to take decisions on behalf of herself or her baby in the best possible way. Have you come
Yeah.
across any scenarios like that?
Yes, definitely. When the lady in question is not able to balance and not able to take decisions, then the role of the spouse or the next caretaker comes a lot, and certain decisions have to be kind of enforced on the lady if she is can be in some kind of self-harm situations also, in which case we have to make the next person in charge to take the decisions for her. These are rare, but definitely these situations do occur, especially in medical conditions, which Dr. Ramya will be able to tell if specific conditions where the women may not be able to take the decisions. But these are required at times.
Definitely, and sometimes it may be a more than one treating professional getting involved in some of these capacity and consent decisions, especially if there
Yes.
are kind of acute risks and emergencies. So again, it's very important not only to have a good family support network or a friend support network for the young mother to be, but also for professionals, also to have that kind of more robust network where you just pick up the phone and you're able to have these kind of conversations at short notice. I think having a standardized system along these lines would definitely go a long way, wouldn't you agree, in such
Yes.
scenarios? Yes, and
Yeah, sometimes pregnancy also poses situations. Like, for example, if a lady is having excessive vomiting, whatever medication she's taking, she's not able to actually absorb into her system. So the drug levels come down, and hence then that can lead to, for example, if there is a lady who's having epilepsy, she takes this anti-epileptic medication, and but she pukes it out. Then the levels come down. She can have seizures. Similar thing can happen in depression, anxiety, and say a lady has panic attacks. She takes medication, but because of her um, ongoing pregnancy associated physical situations like hyperemesis, this it can pose a challenge. So it is very important to take the medications at the appropriate time. And if there is any such scenario which is dealing with the drug absorption or interferes with that, then the appropriate dosages and medications have to be actively involved by the physician as well as the family, and the corrections have to be made so that ultimately the lady will be in balance.
absolutely. And coming from the perspective of a child and adolescent psychiatrist, one very common scenario I do encounter is teenage pregnancy. And of course, there's a whole,
Yes.
that's a completely different kind of, there are legal and safeguarding implications involved with all of that. So if in the event of such a scenario, I suppose it'd be really important, again, all the more
Yes.
important for an obstetrician and a psychiatrist to work closely to ensure that there is a systematic approach and a systemic
True.
approach to things. Great. So moving on, so
Yes.
postpartum,
Mm.
again, a completely different challenge. I don't think anyone's quite prepared for it until they experience it.
Yes. Yes.
So what are your
There are,
kind of, what are the most common things you might encounter in that period?
yeah. So for any lady, post-delivery poses much more challenges than pre-delivery. In pregnancy, during pregnancy, they have certain physical challenges. They get adapted, and the journey goes on 9 months, and then there is delivery. So when there is delivery, the preparation for delivery, anticipation of labor, anticipation of pain itself poses a lot of challenge to the women. Obviously, nobody will like pain. So when it comes to delivery, and especially a normal delivery, the fear of pain itself can make put down a woman. And already, if she has a pre-existing condition, this can be exaggerated by this condition. And in these scenarios, a very good support from the obstetrician in concern, and especially a multimodal approach where you have painless labor, epidural analgesia. These things can go a long way in assuring the women as well as in supporting her during the labor, so that the labor or the delivery period itself will not be very stressful and traumatic to the lady. So if this period is dealt with well, then the postpartum time becomes a little more easy. So if you are not having terrifying experiences during the labor, then the rest of it will be a little more easy. And then when it comes to postpartum, the challenge, most important challenge which the women can face is about breastfeeding, looking after the baby, a tiny life, a small little human being who's in your hands. You won't know, many girls, especially the first timers, will not even know how to hold a baby. So realizing that they have a kind of huge responsibility of looking after this little individual, and going forward with that, that feeling itself may be a little difficult to take by some individuals, and also they'll have the stress of after pains and bleeding, anemia, and medical conditions associated with that, which can the physical part can exaggerate the mental agony which the lady may be facing. And then comes this most difficult part is not having adequate sleep. Since you have to breastfeed the baby every 2 hours or so, and so you are not going to have any more continuous sleep. This awareness of this fact itself can be little difficult to the girl. So if she is well prepared during the pre-delivery time that this is going to be the scenario and how she can deal with it, how she can say that you can sleep in breaks and then go ahead with the overall you can get your 8 hours of sleep. These kind of extra supportive advices or scenarios which can be sunk into her brain may make her face it difficulty. And sometimes there are situations where definitely the lady can go off track and she can experience mild depression symptoms which are called postpartum blues, and this can be a little of different severity, and then in which cases the recognition of these and then take timely help from psychiatrists and counselors can help in long way in dealing with these situations. Dr. Ramya can throw more light into the treatment aspects.
Well, it's fascinating, isn't it? Because there is a certain when you look at it from a societal perspective, all of one's energies and the family's energies, it's all geared towards that one end point, that goal, which is about getting the baby out. And now the baby is out. Now suddenly it's an uncontained situation because what are you focusing on? And there are so many pressures and requirements and expectations on the new mother that even with breastfeeding, it's quite easy for a mother to feel inadequate if she can't, get enough milk out, isn't it? And it's the most natural thing in the world. Not everyone is equipped to.
It takes some time for the breastfeeding to establish,
and it may not establish at all, and that's perfectly fine as well. But just the expectation, the requirement from the society, and what they're expected to do does put a lot of course, pressure. And then there's of course, pregnancy and childbirth is all about hormones, and hormones are all about emotional ups and downs. So that's very, very difficult, isn't it? And of course, as you said, it's all about changes to one's body. And now you're left with not just an additional responsibility that you quite don't know what to do with, but also, I think then gradually, self-esteem and fears around changes to one's body. How do I look? Body image, and just the worries. And it doesn't help if you end up with dark circles because you've been you lack sleep and you lose your pregnancy glow. So when you start thinking about it, there are so many thoughts that can kind of jump in on a new mother. I suppose one of the other very difficult scenarios is for parents to come to terms with the fact that they may have a disabled child or a child with birth defects or a baby that needs special care on their hands. And that is an extremely difficult scenario to be in. Equally harder is having to face the loss of a child as well, having a stillborn. Yes, and I'm sure you would have come across many of these situations in your daily practice.
That's a very, very traumatic situation for the women and the family and everyone involved, including the obstetrician or the doctor and nurses. The whole team is
devastated,
generally very much traumatized with this kind of outcomes. We have to be kind of prepared to deal with such situations also. So any person who can be affected in these situations, and whoever is the person who's affected, they do need support.
Absolutely.
And here comes the role of all your friends and relatives and your well-wishers who will be supporting the person in question. And sometimes they may require a professional help as well, like counseling,
counselors,
therapies and medications. sometimes very rarely they do need admissions also to deal with an emergency situation, these things. And recognizing these and early treatment and support goes a long way in dealing with this. Yes.
Yes, and it's yes, and it's a shocking event when it happens, but also one has to pick up the pieces and life has to go on. So it's about also being aware of the longer term consequences of this, the impact of this on the mother and the family, I think, and not very important to recognize that the man can be equally, if not more, affected, and give
Yes.
the father adequate support, sometimes forgotten, but very, very important and crucial, I think, and supporting the father to be as well as the father through all stages of pregnancy and beyond. Certainly is something that we would all need to consider, and coming to terms with not just the bereavement or the loss, because irrespective whether it's a disability or a loss, it is a loss in some sense, because it's a loss of certain dreams, certain aspirations, a few expectations. So it's about coming to terms and adapting with life, isn't it, moving forward? I think we have so many things to talk about, so many questions. So for those of our viewers who might still have additional questions, please feel free to send us the questions on the chat here, and also you can email us on info@imonslondon.com. We'll try our best to answer some of your questions, all your questions. We'll try our best to answer them. But in the meanwhile, I think one very important scenario I would like to consider is about a mother who has a physical health, a lifelong physical health condition, like, well, it might be kidney disease, heart disease, diabetes. So for her, it's about recovery from that pregnancy and kind of important considerations about future children and all of that as well, isn't it?
Yeah. And sometimes there'll be situations where the babies are in the neonatal unit and not with the mother. Those are the situations where we as healthcare professionals, we know that the outcomes are generally favorable and the baby will be with mother. But this period from delivery to the baby coming back to her can be very, very difficult. And it is again a kind of emergency kind of situation where she requires a lot of support from multiple groups. It could be nurses, doctors, obstetrician, or sometimes the therapist or the psychiatrist who may play a role in supporting her and the family. But this temporary pressure situation also needs to be addressed, and we need to recognize and this help them out.
Absolutely. And as we all know, after every child, it's a long process of adaptation and a completely new chapter. Here is wishing all new mothers to be, and all mothers to be and new mothers, luck and every hope in the world. And it's a wonderful experience. I'm sure, bringing children into the world is an absolutely incredible experience, and that's the way nature intended it to be. So thank you very much, Dr. Padmalata, for being part of today. And those of you who require further information, we have specifically geared modules towards supporting women and children and families around their mental health and emotional well-being. So do get in touch. You'd find our contact details, and wishing everyone a lovely rest of the day. Thank you, everyone. Bye for now.
Thank you, Dr. Ramya, and everyone. Thank you.
Thank you. Bye.